It's been a very rewarding experience. It's been a very enjoyable experience. It's been challenging at times. I don't look back and regret anything that I've done or anything I've seen with it. It certainly broadened my horizons, made me more aware of the rest of the world, which probably is a good thing. We live in I think a very self-focused age at the moment, so it's perhaps very good to get away from that. I've enjoyed all of the missions. The most challenging and perhaps the most exciting was when I was in South Sudan. It was my first mission in South Sudan, and there was a lot of fighting going on. I mean, in 8 days we had 320 gunshot wound patients. Fortunately, there was an excellent nurse there who helped with the triage, so we managed to sort out the patients that needed very urgent surgery and those that did not. But it was a particularly busy time, so that was exciting as well as challenging. In the NHS, you'll have lots of resources, you'll have a big team, and you'll have a lot of modalities to investigate patients. When you work with MSF, you're going to have to cope with most aspects of surgery, which will be fairly broad, so that will include general surgery, certainly a lot of orthopedics. If there's trauma, that might be gunshot or machete wounds. There'll be some plastic surgery, usually not too complicated, but certainly will involve skin grafts. And of course, there'll be some obstetrics, which is for the caesareans, which is a very important part of the work. Where I've worked up till now, there hasn't been any x-rays, which is sort of challenging. There were very few blood tests available, so you're going to depend for your diagnoses on a history and a good examination, so it certainly can tighten up your clinical skills. You deal with quite a lot of burns. I mean, the reality is that most people, certainly in the places I've worked in Africa, will be cooking on open sort of charcoal wood fires. So you get quite a lot of burns, particularly in children. In terms of things I've never seen in the UK, seen children who've found ordnance, sort of unexploded grenades, and playing with them, inflicting horrible, terrible injuries. Usually more than one child at a time comes in with multiple tiny lacerations and sometimes penetrating lacerations into the chest, head or abdomen. Usually there's not been a doctor anaesthetist, there's been a nurse anaesthetist, and the anaesthetics have been ketamine or spinals. So in the theatre there's not usually a ventilator. There's relatively simple monitoring, which is usually a pulse oximeter and not much more. The theatre kit's usually kept fairly simple and straightforward. That's quite easy to adapt to that. There's no x-rays at most of the missions, I don't think. There's a relatively limited number of blood tests that can be done. I think it's when you're in a situation where you can't help people at all, really. Or that might happen because people come to the hospital very late. They might have tried traditional medicines through a traditional healer. That might delay by days how long they would spend before they appear. And of course, a lot of patients don't have easy access to the hospital. There's no ambulances. I think it's when you get somebody in who's really quite sick, and then you're able to turn it round and despite working in what's a relatively austere environment, and then actually having the pleasure of seeing them go home better.